Can cell-based therapy help with common hip problems? Well, we're going to try to answer that question today. I don't know if I'm going to give a clear answer, but I'm going to try my best. So it depends on what your hip condition is. If you have real severe advanced arthritis of your hips, it's probably not going to be the best option for you. But if you have a certain condition of your hips where you have a lack of blood supply to that part of your hip, it's called avascular necrosis. And that can be a devastating disease because it tends to happen in younger men or women. And again, about 50% of the time we don't know why, but for some reason, their blood supply is diminished. And when their blood supply is diminished, there's a slow choking off of that bone. And when that happens, then the cartilage starts to collapse and then the whole joint starts to collapse. But if we catch it in an early stage, bone marrow-derived stem cell treatment is very effective. Studies out of Mayo and also studies out of the University of Paris, which long-term follow-up has been done over 10 years. The one at University of Paris, over 80% of those patients were able to avoid a hip replacement. And we've been doing it here since around 2014. And if you're in the early stages, stage 1 or stage 2, this is a very effective, easy treatment, which is just a small, tiny incision that's made over the side of your hip. And then a small guide wire is then placed into that area where you don't have good blood supply. And then the cells are then delivered directly into that area. And this can be all done as an outpatient. You just have some limited weight bearing for a while. The complication rate is quite low, although it's not zero, but it's low. And the success rate, again, is in the 80% if we catch you in that stage 1 especially. As the stage goes up and the disease advances, it's less effective. But other common things around your hip, such as bursitis of your hip, sometimes known as trochanteric bursitis, platelet-rich plasma is quite effective. And in studies comparing it to common treatments like steroid injections, platelet-rich plasma came out on top, that it provided a better success rate, that more patients responded to it, and also a longer relief of their pain. Other treatments too of tendinitis around the hip, this can be effective for. So cell-based therapy can be helpful for patients that have hip problems, but it has to be in the early stages and it has to be for the right condition. So again, we're trying to match the right patient with the right treatment. And these are your cells for your healing.